Hi, it's Mark from TLR. I'm here with Iyad Salloum from InSync Physio in Burnaby. He's the clinical director of the North Burnaby office. InSync has two offices in Vancouver and in North Burnaby. And today we're going to talk about dizziness from your neck. From your neck? How do you get dizzy from your neck?
It's a good question, Mark. So basically, the way you find yourself when you're walking, when you're moving, when you're doing all kinds of stuff is your brain gets signals from all over the body, and then it puts them together and in a way processes them, and then you get this kind of thing where you're able to sit up straight and walk in a straight line and all that stuff. So some of the feedback that we get comes from our neck, and our neck's really a rich area when it comes to all these kind of little sensory nerves that send lots of signals to our brain to interpret. So sometimes we get people who, let's say, a hockey player who, smacked really hard into the boards and they get diagnosed with a concussion. And then a few weeks on, a few months on, they're still experiencing some headaches and some dizziness. So I know, like last week, my colleague Heather filmed an excellent video with you about headaches that originally, I guess, started from the neck, where the neck gets really sensitized and it can kind of give you these fake symptoms that look like you have head symptoms, face symptoms. And this is really no different. The way you want to think about it is this. We have our vision that tells us what's happening. So you get to see what's in front of you. You could tell what's straight and what's not. We have our inner ear, which helps us figure out where our head is moving. So that's the vestibular organ. And then you have our neck. So for example, imagine if you have a mismatch in those three signals. So your eyes are telling you you're facing straight ahead. Your inner ear is telling you you're facing straight ahead and you're not moving. But your neck is kind of perceiving a movement slightly different. So it says maybe you're a bit on your side here or you're a little bit there. So that mismatch is basically what could produce some feeling of unsteadiness. And most people just label it dizziness, which is this general vague term. But really, it's just a confusion between your senses.
So the symptoms are dizziness. Is it more from when you're moving you would notice? Because that's sometimes, I think we talked about that the last time. Is that a movement thing, or is it you're still and you're like you described, you're in one spot and you're feeling dizzy suddenly? How does it manifest?
Yeah, most people will feel it when they're moving. And that's when they'll tell you, like, I turn my head and I get this. And they think, you go on your Google and you think, oh, I got this loose crystal that's in my inner ear that's causing this. And that very well could be a thing, but most people will feel it with movement. If in really sensitive cases where it's like super aggravated, you will sometimes feel it at rest, where you'll feel just a bit off. That's kind of the sensation. You'll tell you, oh, I feel like I'm on a boat. I'm just kind of, things are rocking a bit slowly here. So yeah, most people, I would say it's an impairment with movement. And, that's, I think, if you think about that, that's the whole purpose of rehab, is to kind of help you get more comfortable with movement. And that's where I guess a treatment program will be very helpful.
So how do you go about diagnosing this?
There's quite a few tests. So what we will do usually in an exam is we will do a neck exam. If we suspect a concussion, we could do some kind of tolerance test where we get somebody's heart rate up a bit to see if just a spike in heart rate will cause this symptom. So that's one potential reason. The other thing is we'll do an assessment to the vestibular system, where we try to kind of challenge some of those reflexes that our inner ear is responsible for. So usually it's a bit of a process of elimination. It's not this, it's not this, it's not that. And then we have some specific tests for the neck where we basically test how well you can locate center with your eyes closed, for example. And we have these tests, the test for joint position error. We get you to close your eyes, perform a task, and then turn your head one way and come back and see how well do you land on the center again. And that could be, again, another tool that we can use to figure out if there is something coming from the neck. And we'll find with most people is it's never just an either or. You can also have these overlapping things, like you could have a concussion, you could also have neck symptoms from the impact, for example, of that hockey player into the board. So it tends to be, we work through the impairments one by one, and that's kind of how we figure out exactly what contribution is coming from just the general system to the neck to the inner ear.
So how do you treat this?
Yeah, so there's lots of treatment options, which is great. Some, manual therapy to the neck can be very, very helpful in some cases. Manual therapy is not just for loosening up joints and loosening up muscles and improving movement. It also gives us a lot of because these areas are so rich in sensory nerves and you pay a lot of attention to your neck because the neck serves your five senses. Really, if you think of any treatment delivered there, can actually enhance your awareness of the area. So you'll get a temporary improvement sometimes just with one treatment of like a hands-on technique to the neck. And our therapists are experiencing different styles of treatment, but they all seem to work pretty well in this population. The other one, which is really important, is there's some exercises that are specifically targeted towards that. There's no one size fits all because you're going to get people with different impairments. Some people who have an issue only when they're standing and turning their head. Some people when they're sitting and turning their head. And some people when they turn their body with their head stay still. So, and like think of a swimmer who's swimming and just rotates their torso while their head still faces forward. So you try to kind of target the exercise approach to fit the impairment instead of just giving this handout sheet that, here you go, this is what you do in case of a headache or in case of a dizziness case. So yeah, it tends to be a bit of a mix of some balance and control of the neck, which is something a lot of people don't think about. But the neck, like any other joint, needs to move well. You need to have good strength around it and you need to have good control around it.
And what's the typical course of treatment? I know it's going to obviously be very individual, but what's the more typical time frame?
So initially, let's say we would assess if there's any loss in range of motion, we would try to get that going. There's usually a lot of fear based around moving the head because you're kind of worried about triggering an episode of dizziness. So it tends to be a small exposure program almost, where we try to kind of get people to practice moving with or without different cues. We would do a neck strengthening program as part of this. But yeah, the sequence of progression tends to be, let's say if you're really low functioning at this point because it's so symptomatic, we would start very minimal and kind of progress you onto that. And that could go anywhere from a 4-week treatment program to 6 months, depending on how sensitized everything is and how much is at play here and how long has it been at play. In some cases, it could be on the faster side where, they're fairly high functioning and they only get this kind of episode when they're doing something very specific, like when their other senses are very challenged. Like imagine walking on a tightrope and then turning your head, well, that's going to challenge your balance system quite a bit more than if you were just sitting still and turning your head. And the reason is we have amazing senses in our body that can compensate for that. Like your vision's so awesome at just kind of covering a lot of those deficits. And, your inner ear is so good at that, the vestibular organ. So it'll depend on what's involved. But yeah, it could be anywhere from 4 weeks to 6 months. And, the idea is you would need reassessment for you to actually figure out what timeline we're looking at, because it's never going to be, we know exactly from the first day how long you're going to be. So it's more like we judge the improvements week to week, and then that'll give us a better idea because we have more data to judge how you're going to progress through your treatment.
If you're having some dizziness, you've had some neck issues of some sort, perhaps turning your head is causing you to feel a little bit loopy, perhaps, call InSync Physio. You can book online at insyncphysio.com. You can call the North Burnaby location to make your booking as well, 604-298-4878, or in Vancouver, 604-566-9716. Get it looked after. The sooner you start, the sooner you're going to be feeling better and a little bit more oriented well in space and time. Thanks, Iyad.
Thanks, Mark. Appreciate it.